We are pleased to be joined today by Nancy McClain. She's a veterinarian at the Animal Health Center, and Michelle LeRoy, and she is a veterinary dermatologist at the Veterinary Allergy and Dermatology Clinic. Michelle, Nancy, thank you so much for taking the time to be with us.
Thank you for having us.
Yeah, happy to be here.
Yes, thank you. And I think we'll just start this off with Nancy, could you just tell us a little bit about yourself and your career path? Talk a little bit about that.
Sure. So I am a small animal general practitioner. I have been in practice for just shy of 8 years now. I grew up in the St. Louis area, always had pets around, and that kind of started my interest in this field. My mom was a nurse, and she and I like to talk medicine, and that kind of got me interested in science and how we can help others through it. I went to University of Missouri for my undergraduate and was enrolled in part of the pre-veterinary scholars program that they have there. Finished my undergraduate in 3 years and was able to transition to the vet school there, graduating in 2015, and then moved to the Kansas City area after that.
Great. And Michelle, if you could tell us a little bit about yourself and your career trajectory.
Yeah, sure. I'm born and raised here locally in Kansas City, actually, and I went to high school at Scions, a all-girls Catholic high school in town, if anyone's not familiar with that. And then I went on to Kansas State University, where I was getting my biology degree, and I actually wasn't certain where I was going to take that at first. I started to do a research program for undergraduate students through the biology department, but I selected a mentor in the vet school at Kansas State. And that mentor was really kind of influential on my decision to end up applying for vet school. So I did decide to move on and go to vet school at Kansas State, and I enjoyed my time there. It's very different being an undergraduate student versus a veterinary student. But after I finished, I still was kind of not certain that I wanted to do general practice versus specialized. And so I decided to do an internship. I was fortunate enough to have an opportunity to complete that here locally at the time it was VCA Mission Animal Hospital, but it's now the Mission Veterinary and Emergency Specialty Center. And I did a 1-year program with them, rotating through the different specialty departments there. And I spent more time with my current colleague and mentor here at the Veterinary Allergy and Dermatology Clinic during that time. And I decided, after a lot of discussion with him, that this could be a good fit for me, and that he was able to actually offer me a residency position with him. So I was able to stay here locally and do a 3-year residency with Dr. Center, my mentor here, and it was in conjunction with the University of Missouri. So I would go to the university about 4 days per month during my residency with my mentor, and I was actually in my residency when Dr. McClain was there. So I have some similar background as Dr. McClain. I grew up an only child, actually, and so pets were kind of my companions growing up, and my mom was also a nurse, and so I would grow up listening to all of her stories about medical things and thought they were interesting, but I knew that I did not really want to work with humans, at least from a perspective of treating humans. And so that was also kind of influential in my decision to work with animals.
That's great. Yeah, lots of similarities. That's awesome.
Yeah.
And starting from the ground up, what kind of high school classes, or do you have any recommendations for what a high schooler should be aiming towards in terms of what classes to take. Nancy, do you have any sort of recommendations or experience with that?
Yeah, good question. Good question. So, obviously your science classes are important. I also went to an all-girls high school in St. Louis, and we had a really great anatomy course, and it allowed hands-on dissection and just making sure you're not squeamish, because that's part of the job, and also getting those anatomy basics. That's a subject, at least for me, that it's helpful to see it 2 and 3 times. So when you've seen it in high school, and if you see it again in college, by the time you get to vet school, we go, oh, I've heard of that muscle before. So it starts to click a little bit more easily. So anatomy and your biology courses, I think, are really important. But I would also say that your English language courses and your writing courses are hugely important. A big part of the job that I think gets overlooked is the communication aspect, and being able to sound literate in your discharge instructions and in your emails and your correspondence to your clients is hugely important too. So science is the obvious answer, but don't forget about your grammar and your basics and how to talk to people.
Yeah, that's a great recommendation. Soft skills, super important, regardless of what other expertise you're having to deal with. Michelle, is that kind of like a similar answer? Anything to build on that?
Oh, yeah. I mean, I would definitely agree with Dr. McClain. I mean, communication is so important with what we're doing. We can't treat pets without the consent of their owners, so you really need to hone in on those communication skills. I would say any additional thoughts would be just whatever you can do to kind of find some interests that you have. It doesn't have to be science or veterinary related, but if you have some special interests, trying to find some leadership roles that you can develop your leadership skills, something that kind of sets you apart from other people, kind of invents your story and makes you an interesting person. If you have some leadership experience doing something you're passionate about, it's definitely going to pay off as you get into college and vet school. Just trying to experience more as a leader and experience being both a member of a group, but also taking those leadership roles can really help. As far as the science courses and things, of course, if you have the opportunity to attend advanced courses or be enrolled in advanced courses, whether it's AP classes or other advanced courses, it definitely will get you exposed to more and put you on a platform over those maybe that haven't taken those interests in those higher level classes.
That's great advice. Looks like we got a question from Jamie asking, looks like this is for you, Michelle. How much different is human dermatology treatment from pet dermatology treatment? If you could speak on that.
Well, I mean, I'm not a human dermatologist, so I can't really comment there. I will say that it's very different because a lot of what I do, a good 60 or 70% of what I do is treat allergies for pets, dogs, cats, horses. And so in human dermatology, they're probably not they may treat some atopic dermatitis. But there's certainly, like, if you're talking hay fever, rhinitis type allergies like humans have, that's probably going to be more in the allergist wheelhouse, so kind of a separate thing. Whereas pets' primary symptom for allergies are itchy skin and secondary infections and all the things that come along with that. So I'm managing a lot of very uncomfortable dogs and cats and things that maybe don't respond to your Zyrtec and Benadryl very well. So I would say there's probably some pretty big differences between a human dermatology practice or practitioner and what I do. We also treat a lot of autoimmune diseases that could potentially be something that a human dermatologist does. We also treat skin cancers and things like that, although a human dermatologist may be working with different types of cancers than what I might be in pets.
All right. And it looks like we got a question from Mary asking, would you also recommend that students work with animals before college at a shelter or a veterinary clinic? We can go to you, Nancy. Is that a recommendation you would give? Sounds like volunteering at a shelter.
Absolutely, absolutely. I mean, as much hands-on experience in the field as you can get, like the more you can get, the better. A shelter is a great place because they oftentimes have a need, even if it's just walking dogs or helping to clean kennels, sort of the less glamorous parts that probably everybody who gets into the field has done at some point, but are important. I mean, just even being around dogs and cats, you start to learn what's normal behavior, what is normal, like body carriage, and how do I read body language, and all of that's very important. So you can gain a lot of that from the shelter medicine. Oftentimes, you know, if they can get into the clinic side of the shelters, they oftentimes see a really diverse treatments, and you get to see a lot of different unfortunately traumatic cases that come in. You see, you know, a lot of dogs with parasites and things like that, so you get exposed to a whole bunch of different things. There's a ton of space and neuters happening there, so it's a good chance to observe surgeries and be a part of that, and make sure again that you're comfortable with it, and learn from it. I think in addition to shelter experience, if you can get into a clinic, if you have like a local clinic where you take your pets to, asking if their doctors are comfortable with you shadowing or spending an afternoon there, or in some cases like having summer employment is really helpful, or an after school job is really helpful, just to make sure that what you think the field is, it actually is in reality. Because I think a lot of people picture the warm and fuzzy aspect of being in veterinary medicine, and in some cases it can, that is part of it, and it's great, but it's not all that too. And so making sure you actually like it before you embark upon what is a long road is a smart thing to do.
Definitely. Michelle, any words on that, or
No,
about
I think
shelters?
that's a great answer. I mean, anyone who's interested in working with animals for their career should know that that's what they want to do for sure, based on experience, and also just that experience, you know, gives other people the idea, hey, this person's serious about this and is committed to finding opportunities to improve their knowledge and just observe. And that can go a long way when someone's trying to select a person to take a position or be accepted into a school, or those things go a long way, even if it seems like a small thing at the time.
Yeah, that's great. And so it was mentioned that there's situations where you're dealing with people in stressful situations with their pets. And I assume you're exposed to different forms of, you know, visceral moments, maybe upset owners. How do you deal with that? And does a veterinarian school have classes on how to deal with these types of situations? We'll stay with you on this, Michelle. Is there classes for that? Do you know you have that ability innately, or how does that work?
Right. You know, at least in my experience, there's so much coursework to go through in veterinary school that there's not, from what at the time I was there, I don't recall any specific courses that cover interpersonal skills and things like that. Although we have a lot of clubs and organizations that meet outside of classroom hours that have lots of different subjects that they cover, and in many of those groups there may be specific meetings or things that are done to improve your education about those skills and how to work with clients well and that sort of thing. It could be different now. I mean, mental health and things are very forefront compared to even just pre-COVID. So, you know, there very well could be more opportunities now than even when I was in vet school to hone in on those skills. I definitely want to hear what Dr. McClain says, because as a dermatologist, I deal with some very challenging conditions that are chronic and not curable. However, a lot of them are not necessarily end of life conditions. There are certainly exceptions to that. Some conditions that I definitely do have to discuss a pet's potential end of life, but a lot of the frustration that my clients have are based on quality of life and the frustrations that are seen with managing some of these allergic type conditions and things that are very ongoing. So I just always have to try to put myself in their shoes and imagine what it's like for them, and remember that we're doing this for the pet. So even if someone is being a little bit challenging to work with, we still have to remember that our ultimate goal is to help the pet. So if I can help the pet, then I hope to be able to find a way to find common ground with that client. And sometimes you do have to step back and say, hey, I'm trying to help you. I'm on your team, and this is something we have to work together to find the best solution for you. But it's not always easy. But I know Dr. McClain probably deals with a lot of different situations with beginning and end of life. And so I'm sure she has some other insight as well.
Yeah. This is the one area that I felt like was lacking with my clinical training. And I think to Dr. LeRoy's point, there's so much you just have to learn that I don't know that it's anybody's fault that it doesn't get that much attention in veterinary school, because you're busy learning medicine and surgery and all of those other important things. But it's one of the most important parts of practice, if not, well, yeah, if not one of them, the most important part. You could know how to help the patient, but if you can't communicate that appropriately to the client, they might not understand what they need to do at home. They might not need to understand how important or, you know, how grave a prognosis is in some cases. So when I was going through vet school, they did offer various sessions that we took part in. We had, I think, an afternoon where actors came in and we had to practice giving bad news to them. And that was helpful. You're not used to doing that. If most people aren't, if you're lucky. So it definitely takes practice. It's something that we continue to work on. Our last staff meeting was on giving real-time feedback just to the people that you're working with, because you're working in a really intimate setting and you're dealing with a lot of emotions on the day-to-day. You can go from a puppy visit to an end of life or quality of life visit, and learning how to navigate that and communicate with your team is important too. I find that that's an ongoing learning thing for veterinarians across the board. And of course, here as I'm rambling, figuring out how you can be concise and direct with your clients and transparent with them is takes a lot of practice, because now that insurance is getting a lot more common in the veterinary sphere. But a lot of times people are paying for their pets' healthcare needs out of their kind of discretionary income. So you need to be open and honest about the cost associated with things. And that's not something that most people are comfortable talking about, finances, in addition to the medicine, laying out treatment options as far as, okay, this is our Cadillac option if we have all the money in the world, or, you know, if that's not available to us, what else can we do? And that takes a little bit of dialogue and getting that rapport with your clients.
That's great insight. Yeah, I can only imagine how sensitive and challenging navigating the communication can be on a day-to-day basis. So no, that's great insight. We've got a question from Mary. Where is the most demand for veterinarians? Is it small animal, research, industry? Could either of you speak on that? Like, where is the demand at the moment? If either of you guys are aware of this.
Everywhere, I think, right now.
Ah.
I have a cousin who just graduated or is graduating this year from veterinary school, and the offers for these new graduates are quite nice because the demand, at least in small, it seems like in small animal medicine, everybody, especially after COVID, is looking for this particularly small animal veterinarians. So many people got pets during that time. So there's a lot more patients out there that need to be seen, and these clinics are kind of bursting at the seams. A lot of the older veterinarians retired during that time, and there's been some consolidation of practices. And it seems like it's a great time to be looking for employment as a small animal veterinarian. I don't know about in the specialty field, what you guys are seeing, Dr. Roy.
Yeah. Well, can I speak?
Oh, please go for it.
Okay. Yeah, I mean, I think there's always going to be a need in large animal veterinary medicine and equine and things like that, because, you know, they're in rural areas in particular. It's just sometimes harder to draw folks to want to go live in those areas, and unless they maybe came from a rural area and would really like to go back to a rural area. So I think they always need people in large animal medicine. I mean, let's be real, sometimes the physical aspects of large animal veterinary medicine limit the amount of time that can be spent practicing, doing some of these very physical activities with large animals. So some older large animal veterinarians will start to do more mixed practice and things where they're seeing smaller animals as well to have a less physical job compared to what they have maybe been used to. But as to what Dr. McClain had mentioned, there's actually a little bit of kind of newer decline in specialty. Oh, sorry. My office light goes off when the timer has gone by. So anyways, there is a little bit of a decline in the specialty fields across the board. As Dr. McClain mentioned, there's a high demand for small animal practitioners, and new graduates are finding very lucrative positions and lucrative pay. And I think that's steering some people away from specializing when they may previously have done so for various reasons. A lot of different things might be included within that choice, but there is a little bit of decline in those interested in entering the specialty world for veterinary medicine right now.
Yeah,
and some efforts being made to try to improve that too.
I see. Yeah, I can definitely see the boom would have happened. I got my cat Keo during the pandemic, so now I'm part of the whole supply and demand situation as well. And so to get specific, small animal, would that just include just cats and dogs, or do you see other animals outside of that, Nancy?
Yeah, good question. So classically, small animal refers to dogs and cats. Typically, we call it like exotics generally when somebody treats our reptiles or more pocket pet friends, like our guinea pigs or rodents or degus, things like that. One of our doctors at our clinic does see some of those small animals are small mammals, but yeah, dogs and cats classically.
Okay. And Michelle, you mentioned you work with dogs, cats, and you also mentioned horses. Does that expand even further with your dermatology work?
Yeah. As a specialist, we have to learn it all. Dermatology for large animals, equine, small animals, exotics. Now, when you get into practice, you may do something in your own niche. There's a dermatologist that sees a lot of fish. There are definitely a lot of horses that have allergy problems that we see. I've seen a goat, especially because I do still go see patients 2 days a month at the University of Missouri. I do see different species through various services there that need a consultation with a dermatologist. Seen potbelly pigs before. So it really expands to a large number of species. However, my day-to-day life is still dogs and cats for the most part.
All right. Looks like we have a question from Nicholas. What advice would you have for someone trying to decide between human med and vet med? Do either of you guys have a perspective on that? How do you decide? Since both of you guys had you said your mothers were nurses in that field. So how did you narrow it into wanting to go into animal medicine? We'll go with you, Nancy.
Gosh, that's a tough question because it's so personal.
Yeah.
I think, truthfully, I thought I could have been happy in either. I kind of picked a lane and stuck with it. But there's been times where I thought, man, like I think I would have really liked to have been like a pediatrician or a nurse, or even there's lots of great options in human medicine. I know a lot of my classmates, I think Dr. LeRoy, like you said, they knew that they did not want to work clinically with people. It was maybe a comfort level or just a personal decision. That wasn't for me, so I would do a gut check and see if that is important to you or not. I always steer people away from, oh, I went to animal medicine because I don't like to work with people, or I don't like to talk to people, because that is a huge part of the job, which we talked about a little bit earlier. My path was a little bit more direct to practice because I did not do an internship like Dr. LeRoy did, or a residency. So after the 4 years of veterinary school, I went straight into general practice. I was really, really lucky to have fantastic mentorship where I started out. And so it was sort of like an internship where I was practicing, but had a lot of people I could bounce questions off of and learn from. And I did a lot of studying those first couple of years, looking up my cases for what was on the schedule the next day. So I kind of liked that I got to jump right in and learn how to practice. Whereas, obviously in human medicine, it's a really long road where you're going from, 4 years of medical school to internship to residency of varying length, and oftentimes a fellowship. So keeping that in mind, as well as your debt load that you're taking on when you're going through school and what your expected income is going to be, and where you're going to practice too. So all of those factors, I think, are important to think about.
Yeah. It's a very personal decision-making process. And Michelle, you seemed very determined about your path. Any words on that sort of decision-making?
Well, I think Dr. McClain made a really good point about the length of time that you spend in human medicine to get from starting medical school to finishing everything is potentially longer. I didn't necessarily have that as part of my decision-making process, but when I look back in hindsight, I mean, there is a lot in veterinary medicine, there is a lot of discussion about debt from school and being able to then pay off that debt. And it's historically been a consideration that some veterinarians don't always make as much as their human medicine counterparts. And so paying off that debt is something to really be aware of, that if you incur, hundreds of thousands of dollars of debt, you want to have a plan for how to pay that off. It's definitely not something to overlook when you're planning for school and going forward with everything. You can sweep it under the rug, but it's still going to be there at the end of the day. And so don't forget to think about that. For Dr. McClain, that was super nice to be able to just jump right into practice and start making an income and not having to go through extra schooling. My personal feeling was just that I was more comfortable working with animals as my patients, and I like talking to people, but I kind of felt like, for me, I know this sounds terrible, but it kind of grossed me out more to think about working on people and stuff. And having my patients, I mean, obviously dogs and cats they can bite, they can fight, but I didn't really want my patients to be able to talk back to me necessarily. And so I really just never had a passion to consider human medicine. I'm sure that if I had gone that route, I would have been happy, but I just didn't have that desire to look into it more, like some of my friends who ended up in human medicine. So hopefully that's a
No, yeah, that's it's a really good perspective to share. And you mentioned aggressive or scared animals. How do you deal with handling aggressive or scared animals? Is there like training on that? Do injuries occur often? We'll go back over to you, Nancy. Any words on that?
Sure. I have somehow found aggressive and scared animals to be my niche. I feel like they find me or I find them. I don't know how it works. So I have a soft spot for the dogs and cats who are scared to come to the vet, and their poor owners who are anxious and traumatized from poor veterinary experiences. So there's a movement and something that a lot of veterinarians have training in called Fear Free. And they offer, it's a great way to get continuing education on kind of gentle handling practices for those patients. So at our practice, across the board, we're using lots of treats. We're trying to get down on the floor as often as we can. I think a lot of times, people, if you look at like a Norman Rockwell book or something, it's a dog on the table and the veterinarian examining, this dog that's standing there stiffly. We try to be where they're most comfortable, offer them food. We try to keep our hands on the patients the entire time. It's a lot less startling to go, oh, we're going to look in your mouth here, and then we're going to get to your rear end and look down there, trying to maintain the nice, smooth touch gradient. And we work on reading their body language quite well. If like Dr. LeRoy said, they're not talking back to us, but they are communicating. And so becoming an expert in what cat body language is and what dog body language is. And, you know, when you're kind of getting the green light to say, okay, everything's looking good, we're proceeding, nobody's scared here, it's okay for us to keep going, we do. But if we start to get some of those warning signals where, you know, we're seeing the whites of their eyes, or they're getting a little bit more stiff posture, or that tail is sticking out straight and rigid, then you might need to go, okay, we're starting to see that my patient's getting a little bit nervous here. Let's pivot and let's figure out how we can make it more comfortable. Maybe that's just hands off for a minute and give them a break. Maybe that's asking them to sit or do something they know. Or, you know, if it's after an injection, a needle poke or something, and they don't like it, sometimes we put a little like local numbing cream on them before giving them vaccinations or blood draws, and we find that that helps a lot too. So that's kind of your typical patient. If we have a truly aggressive dog, a lot of times, or cat, a lot of times we're using pharmaceutical intervention to try and help lower their stress, lower the anxiety before they come into the clinic. So it goes back to communicating with the client to say, hey, I really think this is going to help Fluffy at this veterinary visit be lower stress, require less physical restraint, and make it a better visit and a safer visit for everyone. We work a lot on muzzle training too for those dogs who, even with, you know, medications on board, are still anxious. And we also offer a lot of happy visits at our clinic. So we have patients come just visit, just come get treats, start to think that this place here is just a gumball dispenser for treats, and that you don't get pokes, you don't get held, it's not scary. And we, in some cases, work on very specific things to make those veterinary visits smooth for everybody.
Awesome. Yeah, sounds like a lot of cumulative knowledge just over time and then case by case basis. Michelle, do you see a lot of scared and aggressive animals, and how do you handle that? And were you able to gather any of that knowledge from your educational experiences, or was this more like in-person experience as you go?
Yeah, I think a lot of it is probably kind of real life experience, and once you get into practice, learning how that will look. I mean, when you're in your clinical years in vet school, you'll definitely get a glimpse of that, and working with patients more day in, day out, and seeing different mannerisms and different types of pets and things. But I think I like Dr. McClain's answer. Being in general practice, she's able to work with a lot of these things, and sometimes we have to do similar things where we're helping to desensitize a pet to getting injections, because one of the things we do really classically is administer allergy injections to pets at home, and their owners actually are administering those to their pets. So there's a big learning curve there, and we sometimes do have to work to desensitize those pets to that process. And it's definitely variable. Pets will often feed off of anxiety. So if their owners are very anxious people or have a lot of anxiety around, say, giving those injections or having to administer another treatment, it can be really tough to desensitize the pet because they kind of feed off of each other's energy. And so sometimes it's about educating the client too about how can they take a better approach to their pet with their pet's anxiety at home, trying to work to desensitize them with positive reinforcement for ear cleanings and administration of other medications to them that have to be done regularly. I think, you know, the treats are definitely, like Dr. McClain said, a very important thing. Positive reinforcement, muzzle training can be helpful for pets that may even act aggressive towards their owners at home too. But there definitely are a lot of patients that come to our office that are fearful, and we don't necessarily probably have as much time to try to correct those behaviors per se, as what maybe a general practitioner may be focused on trying to do. And so sometimes it does require pharmaceuticals, like Dr. McClain said, to try to reduce that anxiety before they come here so we can all have a smoother visit.
All right. And we've got a question from Judith asking, what colleges do you recommend? Any advice on searching for the right college? Nancy, we'll go over to you.
I'm a Tiger through and through. So I loved my time at University of Missouri because I was in their early acceptance program, which is something high schoolers and freshmen in college can apply for to have a seat waiting for them in vet school upon kind of completion of their undergraduate studies. I didn't look anywhere else. So I didn't apply to any other programs. In talking with other veterinarians from other schools, I felt really lucky to be at the University of Missouri. At least when I was going through school there, the way that they have their curriculum staggered, they have 2 years of lecture-based coursework. You are doing your hands-on anatomy labs and your physiology labs. So you do a semester of small animal, dog and cat anatomy, where you're in the lab, and then a semester of large animal anatomy, working with cows and horses. After you've completed the 2 years of kind of lecture-based study, then you go on to your clinicals, which is 2 years of being in the teaching hospital and rotating through the different specialties. So surgery, internal medicine, food animal, equine, all of those different specialties. And for me, that made everything that you learned in the first 2 years kind of come together. A lot of programs, I believe, offer 1 year of that. And so having that extra year was a lot more fun and gave me a chance to practice the skills that I was learning about in lecture. I would also consider, when you're looking at the different programs, because there are some really nice ones where you're on the beach, consider the cost of the program. Dr. LeRoy kind of alluded to it earlier, that the debt load for a lot of students coming out from veterinary school is quite high. And that was a big factor in thinking about where I was going to go to school. Growing up in Missouri, I had in-state tuition. Looking at, if you're looking out of state, your local state, seeing if those places, if you can get to earn in-state tuition by working there is important, and seeing what type of scholarship programs they offer. I was very, very lucky to have a big portion of my school paid for through a research position that I had when I was in vet school. So looking into those things before you commit somewhere to figure out how you can reduce your debt burden, I think is really important.
That's great. And Michelle, college recommendations, and kind of to add to that, do you have to be a pre-vet major?
No, you don't have to be a pre-vet major. You just have to fulfill the prerequisites for the classes that you take for the individual school that you're applying to. There'll be a core set of classes that they want you to have taken, and you have to have satisfied those. In fact, you don't even have to have a full college degree for some of the early entrance programs. Like at K-State, you can finish your prerequisites and start vet school without a undergraduate degree. And then after your first year of vet school, they kind of give you like an honorary degree kind of type thing for your undergraduate studies. So you don't have to do anything really specific with your undergraduate major per se. I really don't think you can go wrong with any vet school. They're all very well thought of, highly recommended. They all have great professors, and I'm sure there's pros and cons to everything. At K-State, I did only have 1 year of clinical rotations in the physical hospital, and I do kind of agree with Dr. McClain that I would have liked to have had a little bit more time with that. But that being said, I also still really enjoyed my time at Kansas State, and I really definitely feel like if you can get that in-state tuition, that you're not going to be going wrong by going to Kansas State or University of Missouri just because it's closer to you than, you know, going out of state somewhere far away where you're going to likely at an out-of-state tuition have significantly more debt. You know, but again, if you had a dream of going someplace farther away, there really isn't one school that is the best and then the rest are not, or, you know, anything like that. There's only, I mean, gosh, what's the running total? Like there's less than probably 30 veterinary schools in the United States. So there's a lot fewer selections than medical schools. And I guess that goes back to the Nicholas's question, I think it was. You have a lot more medical schools to attend and a lot more positions to take in medical school. That's one thing that veterinary school has always been thought of a little bit harder to get into because there's fewer positions to be taken. So you can't go wrong with your choice. I applied to Iowa State University and Colorado State University, and I was accepted elsewhere, but I ultimately decided that it really did come down to being a good decision to go in-state, and I already had loved my undergraduate experience at Kansas State, so that wasn't a difficult decision there. I guess my other thought for those in high school would be when you're selecting where you're going for undergraduate, that really doesn't matter. It doesn't matter what you necessarily have as your major. However, think again about accruing a high amount of debt during your undergraduate years and going to a great prestigious school. If you can get some great scholarships, that's fantastic. But if you do end up having a large amount of debt from undergraduate, you have to remember that you still have a long road ahead of you for professional school, and that probably means more debt. So, you know, in my position, it made sense for me to kind of use that undergraduate through the state school with a lower tuition and then carry forward with my veterinary school education and have that in-state tuition. It ultimately got me to a place with the least amount of debt.
All right. I think you mentioned or touched on this a little bit. Are there good jobs in the field that don't require a doctor's degree? And since you kind of mentioned that, Michelle, are there any good jobs that don't require that doctor's degree?
Oh, man, I mean, of course we have fantastic technicians, which are like our veterinary nurses, and we could not live without them. They do so much for us. They help with our client education. They help restrain pets while we're trying to work on them. They help us run anesthesia on pets that need procedures. They talk to clients on the phone day in, day out when the doctors don't have time to always be doing that. So they're integral to the veterinary practice, and that doesn't require a doctor's degree or anything. But there's not as many positions in veterinary medicine like in human medicine where you could potentially have a physician's assistant or other intermediates between a nurse and a doctor that might be able to prescribe medications and things like that. There's really not as much in the veterinary field to kind of get that intermediate. Usually if you want to prescribe medications and treat pets, make your own treatment plans, you do have to have a doctorate.
I see. Very important, but not necessarily abundant. Is that your same sort of perspective, Nancy? Different point of view?
Yes. I mean, our vet techs or our vet nurses, they are like the heartbeat of the clinics. They are the ones actually carrying out a lot of the treatments, certainly for hospitalized patients and running anesthesia. And they're fantastic, and I think they are unsung heroes a lot of times. There is some talk about maybe mid-level providers entering this space, just because, like we spoke about earlier, the demand for particularly like small animal veterinarians is high, and if it can't be met, is there some way where we can kind of educate our technicians or our nurses a little bit more to be able to prescribe and see patients? So I don't, that people debate that. So we'll see in the next decade what comes of that. The one other field to consider is veterinary physical therapy. There is a pathway where human physical therapists can actually become physical therapists or practice on animals after they've gone through some special training. And that's a field that it's a really, really cool field too. And there's not a lot of animal PTs, at least in the Kansas City area, but they do a lot of really good work, and we utilize their services all the time for our orthopedic cases.
All right, good to know. So we'll stay with you, Nancy. Take us through, what does an average day look like for you? Are you spending time doing paperwork? Is it mostly a barrage of operations? What does that look like?
Yeah. So that's one of the reasons I really liked general practice, and I still like general practice, is the no day looks like the others. Every day is a little bit different. I typically come in the morning and review lab work from the previous day, and then get going seeing my appointments. And my first appointment might be a new puppy or a new kitten. And my second appointment could be a dog coming in, for coughing, and it ends up being that they're in congestive heart failure after you've, spent some time working it up. And then you can see, anything from, just a geriatric wellness visit where it's trying to figure out how do we make the golden years as comfortable as possible for this pet. And then you might be seeing a dog who has a torn ACL, or what we call cranial cruciate ligament. So there's a lot of variety in what I get to see, which is fun. It keeps me on my toes, and I like being able to kind of jump from those different appointments and try to educate my clients on what's going on. We see 30-minute appointments, and so it's pretty quick, pretty fast paced. You have to be rather efficient with your time, trying to figure, especially for like your wellness visits, where you're trying to get, blood draws and urine sample collections and stool sample collections and vaccinations, and have time to discuss heartworm prevention and flea and tick prevention. And if you find a lump or a bump or something like that, that requires a little bit more workup, and then communicate all of your exam findings and plans to the owner. So you have to be very efficient with your time there. I usually spend my lunch hour trying to, on the phone, pretty much just talking with clients if they're calling about questions about their sick pet, or going over lab work, or setting up surgeries and a game plan for how to take care of a problem we've discussed at a visit. And then I have night vision.
There we go, night vision.
And then I have a little bit shorter days. I leave a little bit earlier to get home from kind of my second job at home. But the days are packed and they're busy. And then once weekly, I do surgeries all day long. So we try to save our procedures for one day a week, and then I operate on one day a week, and that can vary too, anything from a spay and neuter to big mass resections, tumor resections. In some cases, we're doing like anatomical corrections when dogs are born with congenital abnormalities. So there's a lot of variety there too. And then I spend part of my day talking with specialists like Dr. LeRoy too, when I have cases that are a bit more challenging, and I think require the expertise of one of the boarded professionals. Then, I can call to see if it's a case to refer or to send to another specialist, or if it's something we can work up in the clinic.
Varies widely.
Guys.
Michelle, are your days sort of unpredictable like that? What does the everyday consist of?
Yeah. Well, we actually reserve about an hour for new patients and do 30-minute follow-up appointments. So I will, on average, see anywhere from 10 to 15 patients a day or so. There's a lot of communication and education with the things that I see. So it sometimes does take a longer time to go through those things, especially with new patients and their owners. But we kind of, sometimes we do surgery days, and sometimes we just scatter the procedures that we need to schedule amongst our appointments. And I kind of like to do that because it gives you a little bit of a change of pace from seeing patients in the exam room to going to do a deep ear flush, which is a procedure where maybe we're treating a pet for a chronic or an infection that's affecting their middle ear, perhaps a mass in the ear canal that we have to remove. We also do a lot of skin biopsies, and one of the major things we do is allergy testing of pets. So I like to sprinkle my day with appointments and procedures kind of being scattered so that we kind of, like Nancy said, just keeping everything a little bit different each day. You never know what it's going to be like. Even week to week, it feels different. And so, yeah, it keeps things fresh and new. And you never, even after doing this for 10 years, I still see cases where things, seem like I've never seen that before, or I need to, kind of figure out a way to deal with something new and different. So it never gets old.
Awesome. And since we are getting close to the top of the hour, this will be our last question. We'll stay with you, Michelle. What do you enjoy the most about being a veterinarian, and what is your favorite animal?
Oh gosh, I think it would probably be a classic answer to say that it's just rewarding to see, say, follow up with pets where you've been able to help their lives dramatically improve by the treatments and things that you've been able to offer them. To see a pet come into the clinic outwardly looking just terrible, because what I treat is the skin, so I can always see what I'm treating. And when they come through the door looking just horrible, and coming up with a plan that allows them to walk back through the door the next time and they're so much more comfortable and looking so much better than they had, it's just really rewarding to see that progress and how much you can affect not only the pet, but their owners' lives when they're not so stressed by everything that's happening to their pet. It's also rewarding to see that human-animal bond and be able to help that person to strengthen the bond between their pet and them. Let's see, what's your favorite part of being a vet, and what was the other part of the question?
And what's your favorite animal?
Oh, okay. Oh man, what's my favorite animal? I work the most with dogs, and then cats second to that. I wouldn't really label myself as, oh, I'm a cat person. Sometimes people feel that way, like they're specifically, oh, I'm a dog person, oh, I'm a cat person. Like, I kind of like both of them. I do still prefer cats and dogs over large animals, just because I didn't really grow up handling large animals on a regular basis. I, of course, rode horses sometimes and did things fun like that, but I didn't necessarily own large animals or work with them on a daily basis. So I still have a preference for smaller animals, but I know it sounds generic, but I like working with dogs and cats. And so it's a good thing, I guess I do that every day.
That's great. And we'll pivot over to you, Nancy. Favorite part about being a vet, and what's your favorite animal?
Yeah, and my favorite part is a lot like Dr. LeRoy, is like to be able to relieve suffering for both your patients and their owners is the best feeling in the world. It's so nice to be able to help. I think that's why most everybody gets into it. That's why I got into it. You know, you see the sad ASPCA commercials, and you know, when you see a sad limping dog or something, you just want to help it. And so to be able to have the knowledge to do so is like such a blessing, and it was really an honor to be able to do that. And when I educate my clients so that they can help their dogs at home or their cats at home, I love that when you hear those, like, get those breakthroughs and they understand how they can best take care of their pet. My other favorite part is just the relationships that you form. I have, you know, been in practice now for 8 years, and so I'm starting to get to the point where little puppies that were brought to me are now 8 years old, and I have had that time where I get to see their families grow up and their kids grow up, and this pet evolve with their families and their changing lives, and that's really, really cool. And to have that rapport and trust with people where they really let you into their homes and their lives is just, it's very rewarding to have those connections. My
Awesome.
favorite animal is right here. There she is. That's my dog, Stella. And I think I gravitate towards dogs, but I love a good cat too. And I would love to someday have a horse of my own. I love horses. I think that they're beautiful and amazing creatures. So I don't discriminate. Give me something furry.
Nice, great cameo, and I love it. Thank you so much, Nancy and Michelle, for taking the time to answer everybody's questions. And thank you all for tuning in today. If you want to learn more about the Linda Hall Library, follow us on all of our social media and visit us at lindahall.org, where I also encourage you to sign up for our e-newsletter. And for the parents and teachers tuning in today, I hope that you consider supporting the library through the Linda Hall Library Foundation. Your contributions make all of our programs possible and freely available. Thank you, and enjoy the rest of your day.
Thank you.
Thank you.
Bye.
Bye.